lots of people are telling you they don't understand it, you're on to something. Many times, that's when you're on to something. So don't give up on it. Pound on it, collaborate, talk to other people. These people.
Am I living in a dream come true? Arms around you dancing.
Every day it seems like there's a new challenge that you've never faced before.
It's great to be in a room with people with similar interests, trying to improve diabetes care.
You have an idea, you know you're solving a problem, but that is maybe not enough.
Any questions, please feel free to reach out and let us know. Back in this room.
My name's Andrew Harani. I am 28 years old. I live in Chicago, Illinois. Groove Health was sparked through a very personal challenge that I had. A family member of mine was diagnosed with a heart disease. He had to start taking medications on a daily basis, 7 of them, and I watched him struggle with that. And we looked for technology solutions to help him, and we were not satisfied with the options out there.
My name's Liam McMorrow, and I'm 28. I've lived with diabetes for 16 years now, and I was given a pump, and I just couldn't get over that the benefits of the pump are relatively simple, but they're not available to insulin pen users. So the idea came about by trying to transfer the benefits of a pump to an insulin pen, and then connect that with an app that offers financial incentives to people to manage their diabetes.
So our core competency is really in developing machine learning algorithms to make sense of sensor data from mobile phones. We basically want to make the management of diabetes much easier.
Healthcare is a very complicated space. There's a lot of very large companies, and they're heavily regulated, so often they are not as eager to work with small companies as maybe some other industries are. So to see Novo Nordisk embracing startup companies and new technologies and actually put together a detailed and well thought out program like this is really unique, and we wanted to be a part of that.
It's quite a complex problem. It sounds simple, people don't take their medications, but when you ask the question,
From an academic perspective, you want to be concise and clear, but from a startup perspective, you want to also have that emotional connection and a story. So I think trying to balance the two is a good pitch.
This is a first type of experience for me. I haven't been on stage presenting this business to anybody so far in terms of on a big podium, this type of thing. Especially as a first-time entrepreneur, you have to do things that you've never done before, and a lot of them, and sometimes that gets very difficult. So if you don't have a passion or some guiding principle, it would become very difficult.
I'd prefer to get brutal feedback that says this is where you were weaker. You rarely get that. You usually get a great idea, keep working hard, but unlucky. And it's that gets to me.
Like if you want to be an entrepreneur, you have to have sort of some sort of resilience to deal with the days where everything is maybe not going you well.
Yeah, you get a lot of no's with the startup. And I think I've applied for over 120 different grants and competitions. And I think I've won about 12. So like 10% success rate, which, I think in the startup world isn't bad, but yeah, that's a lot of rejection as well. So like the worst case is someone says no and you move on. Like, you could be in a slump for a day or two and then all of a sudden it's the next things come along. So I think that's why I find being a startup is easy, because I know I want to work in improving diabetes care.
I wanna spend forever by your side. I wanna love you till the end of time. Oh, I wanna love you till the end of time.
No.
1 3 1 1 3 1 3 2.
There is a bit of tension. I think I feel it just as you always want to do well in something. So as you approach the judgment, whether you make it or not, you definitely feel a little tense about it. We feel like we've put together the pitch really nicely and hoping that we can come out as finalists.
We want young people to know that we acknowledge that diabetes is hard work and they deserve to be rewarded for that hard work.
I'd like to get on the program. I'll be disappointed if I don't. It's a big opportunity for me to receive a lot of validation for what I'm doing. That's important because it's the yeses that make the difference.
See our solution be used by a lot of people, maybe millions of people. That would be a great achievement. But I guess 90% of startups fail, and you have to count on that. Maybe it will not work out.
There we are. Ready? Let's go. Let's go.
On behalf of the jury, we really feel privileged that we were presented with so much good innovation and so much passion for solving for patients living with diabetes. In random order, expert.
Actually, I was nervous 2 times today. One is when we presented and one when they announced the winners. So this is a very big milestone for us. We can develop what we have put on paper, and we can develop that into a real product with Novo Nordisk.
The next one is Adeline.
So having like Novo Nordisk kind of recognize what we're doing as innovative and different. I don't know if there's anyone else in the world you'd want more validation from as a company. It's basically given me that confidence to just like go full steam ahead and build the app and get it out there.
I definitely feel disappointed. I would have liked to have been a finalist, but being able to present in front of a number of people, fielding questions from the judges, all of that is an opportunity to learn. So it's been a great experience, but we won't be able to partner with Novo Nordisk through this program.
It's been a long day, but it's been a good day, and it's been a hectic few weeks, but yeah, great, buzzing. So I've got a lot of work to do over the next few months.
I wanna hold you when it all comes down. Wanna be with you when the lights go out. I wanna spend forever by your side. I wanna love you